Hello, I'm Dr. Hooper. I'm a chiropractor.
Hi, I'm Melody, the massage therapist.
What I want to show you guys today is a way of strengthening your rotator cuff. Rotator cuff has 4 muscles, and their main job is to balance the shoulder and keep it in the cup. So this is your humerus right here, and it keeps it in the glenoid cup of your shoulder. So naturally, you have 2 muscles that are internal rotators and 2 external rotators. So 2 internal rotators, which brings her arm in, are naturally stronger than the external rotators that pull it out. So what we're going to show today is how to do this exercise to help the external rotators and strengthen the overall rotator cuff. Now what's important to remember about the rotator cuff is that it's not big muscles, and so you don't want to do heavy weight ever, even if you're a big buff man or woman. Okay, so here's what we do. Okay. So now we're going to be in the position. One of the things that is very valuable is to have a set of exercise bands like this. Handles are preferred, however you don't have to have that.
Wait,
Yes.
I've seen different like strengths of them. What's the preference?
So you want to use medium to light bands, not heavy bands, because again, these are small muscles. Okay, come on over, Miss Melody. And I'm going to get out of the way here. So what you want to do is you want to keep your arm, actually go ahead and put your arm down on your side, at a 90-degree angle like this. Okay, now we're going to have her lift it up, and then what you're going to do from this position is pull to where it is comfortable for her shoulder. So she goes back as far as it's comfortable, and for her it's right about there. Okay, so you go down and you come up, and you do this you want to do 20 reps for 3 sets, with the last 5 repetitions being strenuous, where you can feel a little bit of a burn. Now, if this hurts or this impinges the shoulder, you don't want to do this exercise, but if it just feels like it's tight and strong and a little bit of muscle burn like normal exercise, then this is good. So you want to do this 3 sets to 20, just like she's doing.
And why do we do these?
This is to build up your external rotators, rotator cuff muscles, to strengthen and stabilize the shoulder. So again, this is not a bodybuilding exercise where you're going to build a lot of muscle. This is just mostly for stabilization. Cool.
And then you
Are we still in this shot?
And then you do it on this side?
Yeah. Okay. So we can splice this again. Okay. So
no, I like that. Are we still in the shot?
Okay. So what we also want to do is you want to do it side to side. So your body needs to be symmetrical. So when we're doing this, she does 20 over here, and then she switches and does 20 over here. And as soon as she's done with that 20, she switches back and does 20 again. And you go back and forth until each side has done 3 sets of 20.
How often?
So I usually suggest patients do it about 3 days a week, if that's possible. And to think about the shoulder, sometimes it helps to actually look at the shoulder and look at the arm, but it's important that the upper arm right here only rotates, that it's not lifting up and not lifting back or forward, that it's only rotating. So if I put my hands like a cup around her arm, it doesn't move up and down. Okay? So, what else can I say about that? How about this?
What were some other things, Dr. Hooper?
Okay, so